As ophthalmologists, we are required to do several tests at a close proximity to the patient, which increases the risk of contracting the coronavirus. Yes, there are a number of equipment that are designed to reduce the risk of contracting this infection. But how protective are they? Let's put them to a test, the Armour test. The experiments done in this video are done by professionals in a controlled environment with all necessary precautions. People have been encouraged to wear masks designed to cover their mouth and nose. Observe the distance and extent to which the smoke gets displaced. Wearing a surgical mask does help, but not completely, as you can see some displacement of the smoke. However, it is better than not wearing one. Whereas with an N95 mask, notice there is absolutely no disturbance of the smoke here. Shields have been designed to protect us while we examine a patient. Notice how the cough particles may escape the shield and reach the examiner, thus becoming a potential source of infection. The best way to protect ourselves would be to use a combination of these, wearing an N95 mask and using these shields while examining our patients.